The message from more than 100 nurses and doctors from the Dersham Public Hospital and other institutions on Friday morning was clear: no money, no work, as they demanded gratuity, risk allowance, and 50% increase in salaries.
Essential workers! Essential pay! Essential workers! Essential pay! Essential workers! Essential pay! Just can wait like this.
As frustration and anger continues to build about the government's delay in granting this category of public servants 50% increase in salaries, the absence of risk allowance and personal protective equipment, the healthcare workers have pledged to continue protesting until their needs are met. The $329.5 billion 2020 emergency budget does not include provisions for the 50% increase for public servants, though the PPPC administration, while on the elections campaign trail, had heavily touted its plans of improving remuneration for government employees. This perceived deficiency in the budget has been criticized by Shadow Public Service Minister and Opposition Member of Parliament Tabitha Sarbu-Haley during the budget debate. Notwithstanding, Minister of Public Service Sonia Parag, in response to these criticisms, had claimed that collective bargaining yields salary increases, not national budgets. This protest comes on the heels of several others that were carried out in Linden and on the west bank of Demerara on Wednesday and Thursday. The healthcare workers are all demanding the same things: better treatment and appreciation for their dedicated services amid the COVID-19 pandemic. Healthcare workers at the New Amsterdam Hospital stood in solidarity on Friday with their colleagues by staging a similar protest action. Minister of Health Dr. Frank Anthony on Thursday repeated calls for nurses to wait until the budget is passed for the risk allowances to be distributed. On the issue of the lack of personal protective equipment at the medical institution, the minister noted that these items are supplied based on requests from the hospital.
On the latter one, as far as I know, once the hospitals make a request to the MMU, which they have been doing, they have been provided with personal protection equipment. So I don't think that should be an issue. Because when I check with the authorities at the Linden Hospital, they have all the personal protection equipment that they need.
Meanwhile, Deputy Chief Medical Officer Dr. Karen Gordon-Boyle had told this newscast that issues could arise if the items were not requisitioned on time. $150 million have been budgeted for the payment of risk allowance to frontline workers. Some healthcare workers are contending that all categories of medical personnel should benefit from these allowances. Temika Rodney reporting for the HGP Nightly News.